hello to all my colleagues in India. My name is Andy. I'm a motor technician in the Erasmus Medical Center Cancer Institute in Rotterdam. And the people from KRS and Macromedics invited me to give you a presentation and demonstration of making masks. The presentation will be held from the Macromedics head office. And it will involve a double shell mask, a single shell mask and a 3-point head only. So here I am at the training center of Macromedics. Let's have a look inside, shall we? Oh wow, look at this. So, okay, first thing we're going to do is show you DSPS. We already positioned the patient in the cradle. As you see, we used a headrest, a normal headrest. You could use a towel if you want to, doesn't matter. We chose a headrest because it looks very nice. Make sure the head is nicely positioned within the cradle, you see? One finger around the head. So these are the two thermoplasts. One for the back of the head, the occipital area, and one for the face, as you can see. This one behaves sort of like a normal thermoplast. You can put it in the hot water, leave it for 4 minutes, 3 minutes, 5 minutes, doesn't matter. This one is the special one. This needs to be in the hot water for about 15 to 20 seconds. Yeah? Okay, let's do this. This is the hot water bath. As you can see, temperature 70 degrees Celsius. So what I always do is I just put this one in, which can be in here for 5 minutes, doesn't matter. And this is the special one, and don't forget. So 15 to 20 seconds. I'm counting. Okay, so we let our patient sit up a little bit. If you please. Yes. Click it on the cradle and ask your patient to lie down very carefully. Yeah. Guide your patient. Just let your patient sort of stretch the material. You see? Let me show you close. He's slowly, look at his ears, he's slowly sinking in the thermoplast. If you want it a little bit deeper, you sort of can push on the head of the patient, just a little bit, see? This is what it looks like from above. So then what you want to do is you want to mold the head in the thermoplast, as you can see. Yeah? See what is happening here? There's also this area, the occipital area. You can also try to mold this area in the mask. Okay, so now we're about 5 minutes later and see what I did. See, there's a sharp line around his head here also. See? Here also. So you will know exactly where to position your patient. And of course, let me tell you that of course this is not a real patient. This is a specially designed model from Macromedics. You can't find them anywhere else. So yeah, it's not the real thing, but you will get the picture. So now we have to do the face. Yes. Okay, let's go to the water bath. Okay, so this one has been in the water bath for, well, about 5 minutes. So it's okay. Yeah, it behaves like a normal thermoplast, so nothing wrong here. So now we need to dry it and put it on the head of the patient. Let's go. So there is a little hole, which of course is for the nose. Yeah. And now the trick is to go down very, very slowly. Give the material some time to follow your move to the cradle. Yeah? So now I'm searching for the holes. They're here, and now I'm fastening the push pins. Important. Make sure you mold this area. Mold the nose. And see, once you've molded it, it stays in shape. Okay. You can mold the jaw if you want to. Yeah? But this is a very important area. Some people think this is claustrophobic. They tear this open so there's a sort of open face structure. Don't do that. Make sure that you mold this very carefully. This will help you position your patient every day. You can mold the head a little bit, the chin. Again, this also takes about 5 minutes to set. But make sure you mold the bony structure of the head. Okay, let's wait for a while. Okay, so 5 minutes are done. Let's take it off. And of course you always show your mask to your patient. There you are, sir. Well, this is the DSPS, but of course it is a very expensive solution. So to help you, the people from Macromedics designed something else. They call it the single shell, which basically is you leave out this part. Put a cushion in there and just work with the top part. Yeah. So we're gonna make one, show you one, with an extra feature. The extra feature I'm going to show you is this little thing, a wooden spatula, and we're going to make a bite in the mask. So what I will ask for my patient is, when I place the mask over his head, I want him to open his mouth just a little bit. And I will push the thermoplast in his mouth against his teeth. So you get a little bite. I don't want my patient to bite, I just want my patient to open his mouth a little bit. So that there's no pressure, no biting going on, just a gentle opening of the mouth. So first we're going to place the mask, the thermoplast, over the head. But I want my patient to open his mouth just a little bit. Okay. Again, push it down slowly. Let the mask follow you. Let the material follow you down. Yeah. Look for the holes where the plunges fit. Yeah. And now the trick with the spatula. I will show you. And don't let your patient bite. Yeah? You will be the one pushing the spatula against the teeth. And then of course you're gonna
again you're going to mold the bony area, the bony structure, the orbita, the nose. Maybe you will do this together with your colleague. You will be with two people working on your patient. So one will hold the spatula, the other one will mold the face, the structure of the patient. Yeah? So now what you have is a bite. So your patient is not able to move his head, to rotate his head like this, yeah, because his teeth are against the mask. Okay. So again, 5 minutes. So as you can see now the spatula is gone, and we're gonna zoom in, and there you can see the bite. See? So this way it will be very difficult for your patient to, well, to move, to rotate like this. And everything starts with the mask. Eh? So do a good job on your mold room or on your CT, whatever. Do a good job, and then everything will go smooth. Also on the Linux. Right? Okay, let's take it off.
Thank you. So, next thing I want to show you is a 3-point mask. And this time I will not heat it in this old trusty hot water bath. No. We've got something else. And it's an oven. So, as you can see, no water, just warm air. So you don't need all those towels anymore, you don't need to dry anything. Okay, and so it's the first time for me also, but you know, let's try it. Let's put it on. Oh, that's nice. Ah, see? Temperature is going up, so we need to wait because it needs to be 70 degrees Celsius. A little correction. I've been corrected by the people from Macromedics. The oven needs to be a little bit more warmer. So the set point is 80 degrees Celsius. But of course, when you buy an oven, they will explain it to you. So, okay. 80 degrees Celsius. Let's try this. Put it in. There is a timer here. Let's see if I can make it work. The timer is set at 10 minutes. Okay. Let's try. Oh, okay. See? It's also new for me, but doesn't matter. So now it's set at 10 minutes. So let's wait. So countdown. Okay. And how do we stop it? Like this. Okay. And this is what it looks like. So this is what it is. I think you need to sort of let it cool a little bit. But let's see how our patient is reacting. First I'm gonna fix the cranial one, and now I will stretch it over the chin, just like this. Very simple. And again, don't tear this open. Make sure make a perfect mold. Pinch his nose a little bit, like low. Mold the eyes. Maybe you want to mold the ears. The
can see, take the camera, it's already starting to set. See? This is still transparent. This is already starting to get blue again, so and if you want to speed up this cooling process, you could use wet towels. Some people use coal packs, you know, these little bags with gel which you keep in the freezer or in the cooler. So then you can speed up the whole process. Else you need to wait for about 10 minutes, I think. So that's a 3-point mask. Very simple, very easy. But I can't stress enough that you make sure you mold the bony part of the face. Orbita, nose, jaw. Make sure you do the best you can. Thank you for watching. Keep safe. Namaste.